So this tape job is for sprained thumb. We tend to call it a thumb spica. Of course, we want to do what we've done previously and ask if they have any allergies to the tape. Make sure they've been evaluated by an athletic trainer, and be sure that we understand what the position is that's best for this patient, what position we're trying to prevent. So typically people sprain their thumb into abduction, so we want to really kind of keep the thumb pretty close into adduction, but still keep it functional. So our goal here is to keep it pretty close to the hand, but still allow them to do their function. And this is going to vary a bit depending on what the needs of the patient are, what that patient needs to do with their thumb. We're going to start with an anchor around the wrist, and then we're going to do an anchor around the thumb itself, making sure we're not going too tightly around the thumb. Then I'm going to use inch tape to prevent the adduction from occurring. So we're just going to go a little bit around the thumb, pull it toward the palmar side. We're going to do 2 strips in that direction. And then we'll reverse those as we still pull the thumb into adduction, pulling down across the dorsum of the hand in this direction. So when you go too far around the web space of the thumb, it tends to get irritated, so this prevents some of that irritation, helps prevent cutting off any circulation to the thumb, going down to those anchor strips. I'm going to apply a series of strips that are going to go across the posterior side of the thumb, reinforcing the adduction of the thumb, preventing it from pulling out into abduction at this point. Overlapping these by about a half. And again, some of this is going to depend on the need for function for this particular athlete, what that patient needs to do, how much motion that athlete needs to have. From there, we just apply one last X strip that helps hold down those, cover up those ends that we had. Then want to be sure we test it functionally, have them grab something if they need to, and see how they do with the tape that we provided.